eastbound because a car has broken down, and the delays on the A2 continue westbound up to the Danson interchange because of the ongoing works.
This is LBC.
Where can you find
Nick Ferrari now. 0345 6060 973. LBC. Nick Ferrari at breakfast on LBC. Call 0345 6060 973.
9 minutes before 8 is the time. Opportunity now to take some of the questions you've put to me through to Conservative MP and Health Secretary Matt Hancock, a man who hopefully has got some of the answers, who joins me now. Secretary of State, thank you for coming to the programme. Before I put some of the questions, it's another great day for you and your colleagues and the tireless work they've put in, more than 350,000 first vaccinations. There's just one concern I put to you. A couple of days ago, you'll know better than I, it was a whisker under 600,000. The day before that, it was just under 500,000. The day before that, it was 414,000. Does this speak to some kind of supply issue in that some days we can do 600,000 and others not so well? Good morning. Good morning. How are you? I'm well, thank you. Waiting for the jab, but I'll take my turn.
Yeah, well, exactly. I'm looking forward to it when it's my turn too.
Indeed.
The answer is absolutely about supply. The NHS team have demonstrated that they can deliver, an incredible number of jabs in one day. There are almost 1 million at the weekend, but the supply is lumpy, And as soon as a big shipment comes in, we get it out to the front line, and they get it delivered as fast as they can. And so, if you look at the chart on the government website, coronavirus.data.gov.uk, you will see that there are some days that are bigger than others.
How can we iron the lumps out, Secretary of State?
Well, we hope to do that over time as the manufacturing matures, and also the more that is manufactured onshore, the easier that's going to be, because obviously then the supply chains are shorter. You'll have seen over the past week some of the challenges that we've had with international supply. So I think everybody can see that this isn't easy, but we're just getting the stuff out as fast as possible.
On the subject of international supply, with our friends and partners and colleagues across the English Channel in Europe, is that all resolved now? Are we all good friends and jolly good company and everything moving forward?
Well, I've got a high degree of confidence that they will stick to their word of saying that they'll honour contractual commitments. And I think that that's the right way to go. I mean, that's where we should always have been. And the good news is that we have a really, really tight contract with those who are supplying the vaccines to us. And I look forward to those being delivered on. We got in there early, and we supported the science, and then we supported the manufacture, and then we supported the testing. So, for instance, this news from last night that the Oxford vaccine is both effective at stopping hospitalization, so it protects individuals, but also that it reduces transmission by about 2/3, so it protects everybody else as well. We found that result because, having backed the science, and then having struck this really terrific contract to work with AstraZeneca, we also put in the testing during the clinical trial so that we could follow each person who was on the trial and find out if they tested positive, whether or not they had any symptoms. It's the only trial around the world where that I know of that did that. And it means that we can find out this result, not just about how much the vaccine protects you, and it does, but about how much it protects you from transmitting the disease, which is so important for us getting out of this.
All right. You talk of a high degree of confidence in that area. Secretary of State, how confident are you that this so-called new strain, South African strain, can be contained in these areas where mobile testing has been going on as we speak?
Well, I'm confident that it can be, and it's on all of us and everybody living in those areas to stop the transmission.
So should key workers go to work, Secretary of State, if they live in those areas?
Key workers do have to go to work. The hospitals still have to run. And so, this is about making sure that the rules that we have in place are followed absolutely rigorously, and everybody does everything they possibly can to minimise contact.
So to a firefighter or a member of the NHS living in that part of Liverpool or that part of Hertfordshire, excuse me, you have to go to work. Should they, though, other people be so-called raiding their larder? Should they, if they can, not go and get provisions from grocery stores or supermarkets?
That's right. So this is the sort of thing that, in the rest of the country, whilst the rules are that you should stay at home unless you have to go out, going out shopping is one of the things that you have to leave home for. However, what we're saying in those areas is if you have food in the house and you therefore don't have to go shopping, then please don't go shopping. And that's guidance because, because people, obviously, if you haven't got any food, then you should go and buy
What
food.
about daily exercise? Is best that they don't do that, folk in these areas?
Well, it's fine if it's on your own and at a social distance from anybody who you come across. We haven't changed the law in these areas. What we've done is through an effort to communicate with everyone, both everybody listening to LBC in those areas and the local authority going around on the ground.
And this new strain, how effective is the AstraZeneca jab, or indeed the Pfizer jab, or any of the others against this so-called South African strain, Secretary of State?
Well, we don't yet know the full answer to that question. That's one of the reasons that we're taking this precautionary approach. But we do think that it will have some effect, but unlikely to be as much of an effect as on the the existing strains.
So what are we talking? 50% of what was more like 80 or 90%? Is that what we're looking at, Secretary of State?
Well, we don't know with a high degree of confidence, but we have got a trial underway in South Africa right now.
Can you still hear me, Mr. Hancock? Because the line.
Can, yeah.
Okay, I've lost a video, so we'll continue. Thank you. Some people talking about various global strains of this are saying that we need to explore further the idea of quarantine hotels. Will they be a reality in this month, in your view?
Well, we are looking at what we can do to strengthen the border measures even more. I mean, right now we've removed all the ability to travel without quarantine at home, so you have to self-isolate, and we've brought in more enforcement to people who do that. But there is clearly, we're always open to looking to see if there's more that we can do.
But if we come specifically to hotels, do you think we will have hotels in position for people returning from countries by the end of February?
Well, we'll set out more details of that when we're ready to. But you've seen that we're perfectly prepared to take very tough action if that's what's needed.
Yeah, the Labour Party is saying we need those hotels effectively now. Do you agree?
Well, I absolutely think that we should be doing everything that's necessary, Nick. I know the Labour Party like to play politics on this stuff. I think that what's better is that we all work together, not least because already there is the very clear legal rules with the strong enforcement behind it that we've now put in place for anybody entering the country as a passenger at all. And now, whether that is enforcement of isolation in your own home or in hotels, it is isolation. And but we're always open to looking at tougher measures.
Right. So the idea they're going to open on February the 15th is not true. These quarantine hotels.
Well, let's see where we get to, and when I've got.
Well, why the delay then? If you're going to do it, why not do it sort of more rapidly, Secretary of State?
Well, there's when I've got more to say on this, I'll be very happy to come on LBC and explain all of the details in full.
All right. Shall we look elsewhere in the United Kingdom? It would appear in Scotland that children in certain cohorts will be going back to school earlier than they will in England, February the 22nd for what are called primaries year 1 through 3. And it is reported there's pressure on the Prime Minister to open the schools here. Where are you on that, Secretary of State?
Well, we've just got to keep watching vigilantly to keep this virus down and get it down. There's still over 30,000 people in hospital. That's more than in the first peak. And we've got to be careful and we've got to be cautious.
Is Nicola Sturgeon not being cautious then, looking for February the 22nd? Is that unwise?
I'm not going to criticise Nicola Sturgeon over this because these are difficult judgments. But what I'd say is that it is just so important that we get the number of cases right down.
Yeah, but why would a child just north of the border be going to Scotland? Why would a child in Glasgow be going to Scotland, but a child south of the border would not, in Gateshead, would not be going to primary school?
Well, look, it's a very good question.
That's why I asked it.
And the legislation governing the approach that we take is, of course, devolved. Education is a devolved matter, so that is a decision.
But I don't need to tell you COVID's not a devolved matter. I ask again, why a child would just north of the border and another child... I mean, how safe is this in your view, Secretary of State?
My view is that we have taken the correct decision in England to keep the schools shut, even though I know, and I know as a father, the impact that has. I think it is important because children can transmit this virus.
I wonder if I can get a comment, just lastly, before I let you go. You might have seen coverage. Professor Chris Whitty, who has done an extraordinary job, was trying to get a sandwich, I believe, one day, either this week or last week, and this is what happened.
Come on, man, stop lying to the TV, man. Liar. You saying? A big man. You're a liar. You lie about the COVID-19 cases, man.
None of my listeners will be surprised that the professor acted with complete dignity, put his face mask on and did not engage. A word on that, if you would, Secretary of State.
Well, I don't think anybody should be treating any of our scientists in that way. Chris Whitty is one of the most renowned and respected scientists in the world. His advice both to government and to all of us as and the population as a whole, has been thoughtful and smart all the way through this. He's got the big calls right, and this man. I mean, it's just not even worth commenting on this.
All right.
This character.
He's got the big calls right. I have to say, you got a big call right. We've spoken about this before. You were initially told to buy 30 million AstraZeneca jabs. You decided to go for 100 million. I read in one newspaper today, The Guardian, this is because you're a fan of the movie Contagion, and that informed you as to how you have to move quickly on a global scale when I can see you smiling, Secretary of State. Is it true that, of course, you use your scientific advisors, medical advisors, emotional health advisors, but occasionally you settle down to Contagion as well? Mr. Hancock.
I wouldn't say that film was my primary source of advice on this, but what I can tell you is that I knew that when the vaccine came good, and I always had faith that it would, that the demand for it would be huge, and we would need to be ready to vaccinate every adult in the country. And I wasn't going to settle for less, in the same way that I wasn't going to settle for a contract that allowed the Oxford vaccine to be delivered to others around the world before us. I was insisting that we could keep the British public and all of the British public safe, as my primary responsibility as the UK Health Secretary is to the health of the nation.
So what did Contagion teach? What did Contagion teach you? Apparently, the scramble to get it on an international scale.
Well, in the film, it shows that the moment of highest stress around the vaccine program is not, in fact, before it's rolled out, when actually it's the scientists and the manufacturers working together at pace. It's afterwards, when there is a huge row about the order of priority. So not only did we in this country, I insisted that we ordered enough for everybody to have, every adult to have their 2 doses, but also we asked for that clinical advice on the prioritization very early and set it out in public. Actually, I think for the first time we set it out in August or September, so that there was no big row about the order of priority, but instead we ask the clinicians, and we do it on the basis of how we save most lives most quickly.
Final question from me. You will be aware Captain Sir Tom Moore sadly died at the age of 100 yesterday. While there have been issues about statues in recent months, is it worth the suggestion that we honour that extraordinary man in some way with a statue, in possibly his hometown or where he was born or in London?
Yes, I do think that we should find a way at the right time to honour the contribution that he's made to the NHS, and he was an inspiration to so many people.
Thanks for your time, Mr. Hancock. Always appreciate you coming on LBC. Health Secretary Matt Hancock appearing here on LBC News Time, 8:05.
On your radio, on Global Player, and
Play LBC.
leading Britain's conversation. This is LBC.
From Global's newsroom at 8 o'clock. New research has found the Oxford AstraZeneca vaccine does work in reducing the spread of coronavirus. Up until now, little's been known about how effective the vaccines were at preventing transmission, but scientists at the University of Oxford found the jab may have a substantial effect, raising hopes over the lifting of COVID restrictions. Simon Clark, an expert in cellular microbiology, says it's a welcome development.
It's a very important finding and really something we needed to know rather than think. There are some questions still around it. It does appear from the preprint that 1 dose might be more effective than 2 at reducing transmission. I'm not quite sure how that works. So maybe in the production process of the paper, stuff like that will get ironed out. But overall, good news.
The study also suggests a 3-month gap between doses doesn't lower protection. Separate research has found almost 90% of people who've had coronavirus will have antibodies for at least 6 months. The study suggests that by December, 8.8% of the UK population had been infected. The head of the group bringing NHS charities together says Captain Sir Tom Moore has left a huge lasting legacy. The veteran, who raised more than £32 million for the health service last year, died in hospital yesterday at the age of 100. He'd recently tested positive for COVID-19. Leah Sparks is a nurse in Essex and says the support from Captain Tom at the start of the pandemic was invaluable.
We were losing our colleagues, we were struggling with PPE provision and inadequate staffing levels, with no real signs of any support from the government. So Captain Tom showed us support during what was some of the darkest times, and he gave us hope.
Foreign ministers from the G7 nations, which includes the UK, have condemned the military coup in Myanmar. In a joint statement, they say they're deeply concerned at the detention of politicians, including Aung San Suu Kyi. The founder of Amazon, Jeff Bezos,